In our morning rounds, the serious consequences of snoring. A new study in the journal Neurology finds breathing problems like heavy snoring or sleep apnea could be linked to early memory loss, even Alzheimer's disease. Dr. Carol Ash is Director of Sleep Medicine at Meridian Health. Carol, good morning.
Good morning.
So this link is not new, but this one is really specific.
Yeah, well, you know what? This study might be keeping some people up at night because what they did was they looked at 2,500 adults, average age of 73 or older, and they broke them down into three categories: normal, those with mild cognitive impairment, and those with early Alzheimer's. And they found that those with self-reported issues with snoring or suggestion of breathing problems in their sleep had decline in their memory or their cognitive function 10 years earlier. So that's significant. And you know, we're not saying that snoring leads to dementia. We didn't see a cause and effect, but this is leading to a growing body of evidence that links sleep to brain health.
So suppose you have one of those problems, what do you do?
Well, you know, there are some simple treatments. I mean, snoring, we used to think it's benign. Even snoring can be associated with an increased risk of stroke and thickening of the artery in the neck. And so when you have symptoms of snoring or symptoms that suggest you have sleep disordered breathing, you really want to take it seriously. There are simple screening that can be done to identify somebody that has a problem. There's home sleep tests to make the diagnosis, and then there's treatment options. So actually, I brought one of the treatment options. This is a CPAP mask that would hold your airway open at night so it won't collapse. But there's some less invasive treatments too: weight loss, dental appliances, surgery, and this is common. 18 million Americans are affected with this. 85% of them have yet to be diagnosed.
You know, there are many people watching this who are saying, my spouse snores all night, you know. Are they going to have memory problems or have an increased likelihood of Alzheimer's?
You know, I am such a big advocate of, if you snore, please reach out. Charlie and I had a discussion about it. You know, I also do critical care. Nothing is more horrible for me than having a person show up with a stroke or heart attack that could have been prevented by simple measures, and this is one of them.
Why? Because snoring is a sign that...
Snoring, as your airway starts to narrow, you'll get turbulent airflow, so it's a sign of sleep apnea. So in sleep apnea, we know it can lead to heart attacks, strokes, and now, as we're suggesting, decline.
And my
memory.
question to her was whether you could reverse the effects. If you detected that you do have sleep apnea or snoring suggests something else, can you correct it and therefore lessen the damage
and
to...
you can,
You
right?
can. Sometimes you can't undo some of the damage. I've seen significant improvements, so it's worth looking into.
This seems very intense, though. I think a lot of people see this mask and they think, I don't want to sleep in that.
I'll tell you though, when you have a patient who truly has this problem, it can change and save their life, and you have to coax them through and get them comfortable, but once they're using it, they won't go back.
Because many of them are going through the day very tired, and this means they're getting rest, and therefore their day is completely different.
Absolutely.
Right.
Dr. Carol Ash, thank you. Always good to see you.